This is the Standing Committee on Health on Tuesday, the 7th of December at 16:30. I wish to welcome all members. I wish to welcome Minister Noma French Mbombo. Warm welcome to the head of the Western Cape Health Department, Dr. Keith Kluter, and welcome to all departmental officials and guests. Also, thank you and welcome to our procedural staff, as well as our ICT support staff and members of the public. This afternoon, the Standing Committee of Health in the Western Cape Provincial Parliament will deliberate on Vote 6, Health in the Schedule to the Western Cape Adjustment Appropriation Bill, B6, 2021. Members, please allow me to remind you of our online conferencing rules, and I'm sure members are acutely aware of that by now. Can I at this stage kindly ask that all members mute themselves, that you kindly turn off your cameras as you will be addressing the meeting. You are welcome to turn on your mic as well as your camera. Please draw the attention of the chairperson in the chat box or by the show of your raise your hand function. I now assume that all are muted and videos are off. At this point, I will now ask members to kindly introduce themselves.
Good afternoon, Chair and Department, Lorraine Botha.
Good afternoon, Chair and the Minister, HOD, Regan Allen.
Chair and MEC and other members, Member Van Vogel.
Good afternoon, Chair. I'm Ayanda Barnes. Good afternoon to the department and to the MEC as well.
Thank you very much. If that is all members, I will now then ask the minute, or rather, let me first ask you, do we receive any apologies? Ms. Jamke?
Yes, Chair, we received an apology from Member Kleko, the EFF member.
Thank you very much. So recorded. Now I will ask the Minister and the HOD to kindly introduce the departmental officials present.
Good afternoon, Chair. Good afternoon, members. Good afternoon, the HOD and also the officials that are with him. And also, I see also some of the staff from my office. Thank you for having this opportunity. Over to you, HOD, to introduce the others.
Thank you very much, Minister. Thank you, Chairperson, and good afternoon to all the honourable members. With me today is Mr. Simon Kay. He's the Chief Financial Officer and the Head of Corporate Services. With him, and also with him is Ms. Mslansla Nkosi. She's the Chief Director for the finances in the Western Cape Department of Health. And then also joining us is Dr. Chris Valabji, who's the Head of Strategy for the department. Thank you very much, Chairperson.
Thank you very much, and a warm welcome again to the Minister, Dr. Kluter, and all departmental officials. Members, at this point, I will now afford an opportunity to the Minister to give us a brief overview or remarks in terms of the Western Cape Adjustment Appropriation Bill, as mentioned, B6 2021, and after which immediately I will afford an opportunity to the HOD as well. Can I kindly request of the Minister as well as the HOD to please try and keep in the time frame of 5 minutes, as we are a bit pressed for time this afternoon. Thank you very much, Minister. Over to you.
Thank you, Chair. Actually, I won't take even 5 minutes. When it comes to monies, I provide that opportunity to the accounting officer and his team regarding the finance. So just in brief, Chair, thanks for the opportunity. What we are presenting now to the Standing Committee is on the adjustment for 2021, 22, 22 estimates appropriations, which is as follows: that from 2021, we were being given the 27.391 billion, which now we are adding 798, and then it takes us to the 28.190 billion. The sources of the funding are coming from the equitable share, which is makes about 2.9%, conditional grants 0.3% in terms of adjusted appropriation, the reserves 22.4%, our own receipts 0, nothing has changed. And therefore, the HOD and the team will be providing more in terms of the meeting and what is exactly going to happen. Chair, I just want also to indicate that this comes at a time that not only us, the health sector, but also the whole country that has got challenges in regard to the fiscal constraints. This budget, it also takes into consideration a shortfall that is coming from for the wage agreement. And also it takes into consideration that we've got a new variant, the Omicron, which at this stage, we don't know exactly what it's gonna bring in, as much as that at this stage, we don't have much of the hospitalization and the death, but it's still unclear. And also it's about where we have been prioritizing COVID, but the other non-COVID cases now, they are coming back to haunt us. For example, the mental health that competes and will still compete with the trauma cases. And also with other chronic non-COVID cases, that some of them we had to decongregate so that we prioritize COVID. Some of them now find that they're coming back. Those patients that used to be ours, in as much as that we've provided the packages of medicines for them to be able to make use during that time that we said that they need to be careful to come to the services. Now they're coming back, some of them actually as the emergency medical emergencies, which now they will compete with the surgical emergencies, which is the accident and all of those. And in some of the hospitals that I visited, like I've been to Worcester, today I was in Tygerberg, you can feel actually in as much as that things are calmer because of lesser hospitalization with the COVID. But staff now, it's only time. There still are some of them actually grapple in terms of coming to senses in terms of what has been happening throughout. So this is the budget we are bringing, Chair, and we understand that in as much as that you might have wanted more, at least we are getting something at the end. The HOD will be able to take us through, or Mr. K, in regard to the details in terms of each and every item that is relevant. Thank you.
Thank you very much, Minister. HOD.
Thank you very much, Chairperson, and thank you for the Minister for the introduction. My comments will also be very brief. You will see that this is an adjustment budget for 790 million rand. It is clearly made up of two big sources of funding. The one is rollover funding of just over 100 million that we got in from the provincial, it's the revenue and the rollovers that we have actually planned for to be able to cope specifically with COVID, and then some other related activities that we have earmarked for the funding. And then the bulk of the money, the 600, just over about 620 million, is actually money that is for the wage agreement. That is the adjustment of salaries of all personnel. And we were specifically at one point reporting back to you that we were concerned about an over expenditure related to that, and that is an adjustment to make sure that we actually balance the books in that regard. So what we are doing this money was for mainly is for the wage agreement to be able to buffer the salary increases that's registered on our system till the end of March. And then secondly is that we use the rollover money for a range of things. But one of the key things for the rollover money is quite a big sizable proportion to be able to mount our COVID response until March 2021. That's specifically about extending contracts for staff until that time, but also in addition to that, to have the necessary PPE, the testing, to have the hospitalization, to have the oxygen and all the things required for the fourth wave as required, and to continue with our vaccination program for the desired impact that we should have for coverage. So all in all, we are presenting to you an adjustment budget that on our estimations help us cover all our funding pressures that's been identified during the year and assist us to move towards meeting all our service obligations while at the same time having a balanced budget towards the end of the year. So thank you very much. I would just like to commend the team that's with me here today. Dr. Vallabhji from the strategy side, so it's bringing our plans and strategy together, and then Mr. K and Ms. Nkosi for the way that we are able to actually do quite sophisticated budgeting in a way that we can do all of these things. And we've built it on a very clear relationship with our provincial treasury. So we're meeting weekly with the provincial treasury. I meet and I co-chair with the head of provincial treasury. So we're in this position that we can do this, but we can also use our experience in this province as part of a national process, a 3x3 process, where we're also guiding the national treasury, national health, and other provinces on a similar process of us working together in this regard. So thank you very much, Chairperson.
Thank you very much, Dr. Klute, for your brief overview. Members, we will now immediately go over to the business of the day. And may I ask that we deal with this report in the following sequence. Members, we all have received the information and the documentation relevant to this afternoon's meeting. So can I please ask members that we deal with pages 101 to 105. Members can then, after that, pose their questions to 106 to 112, after that to 113 to 118, and then to pages 119 to 124, of which pages 125 to 145 are the annexures, and members are also then welcome to ask questions pertaining to the annexures. After members have exhausted their questions, I will then ask members of the public, if they are members of the public present, if they have any questions. So members, I'm sure that you have marked your questions. So we will now deal with pages 101 to 105. I see your hand was up, Member Windvogel, but it's down again. Can I then go to the next set of pages?
Hand was up. Sorry, Chair. My hand was up. Sorry, okay. I've made a mistake.
Not a problem, Member. So I recognize Member Windvogel and then Member Barnes in that order. Members, may I please ask to keep your questions as short as possible and to the point in order for us to cover the entire session, please. Thank you, Member Windvogel.
Thank you so much, Chair. And once again, afternoon to the HOD and his team, because I missed that part. Nevertheless, Chairperson, mine is on page 101. While we welcome the increase, can the department shed more light on whether it had engaged the provincial treasury on the need for more budgeting, that bulk of this increase is coming? Can you hear me, Chair? From yes. Rollovers. Can you hear me, Chair?
Yes, you may proceed, Member.
Yeah, increase is coming from rollovers and funding from national government. because I want to understand why the Provincial Treasury did not see the need to add more funds given the health challenges we are faced with. Then on page 101, Health Facility Management, Chair, if the department can tell us what are the reasons for the reduction in the budget for facilities management and which projects are affected by it. Thank you so much, Chair.
Thank you very much, Member Van Vogel. Member Barnes.
Thank you, Chair. Without wasting any time, I'm on page 102 under table 6.1, compensation of employees. Chair, I understand bulk of this funding is from national government for funding of the 2021 wage agreement and for the Youth Presidential Employment Initiative for Health and Staff Assistant Nurses. Can the department therefore give a breakdown of how much will be used for each of these initiatives and provide a detailed plan on how and where these assistant nurses will come from in the duration of their contracts? My second question, Chair, is on page 102 under table 6.1, building and other fixed structures. Chair, what is the thinking and the reasoning behind the budget cuts and which projects and facilities are affected by this? My last question, Chair, is on page 103 under the rollovers, provincial 100,618,000. For each of these projects, could the department provide details and updates? What are the details of COVID-19 activities related to staff facilities and why these are not implemented timelessly? Thank you, Chair.
Thank you very much, Member Barnes. I recognize Member Allen.
Thank you so much, Chairperson. At this time, I don't have any specific question, but based on the comments made by the Minister as well as the HOD, I do want to commend the HOD and the Minister and the entire department, considering the increase that the department has received, but also the allocations as per the relevant vote. So that's all I wanted to say at this time, Chairperson. Thank you.
Thank you very much, Member Allen, and your comment is duly noted and recorded. Members, that now concludes questions on pages 101 to 105. Can I ask the Minister or the HOD to kindly answer the questions or direct to the relevant official, please? Thank you.
Mr. Bombode? Sorry. Minister, can I? Okay, thank you. So thank you very much, Member Van Vogel. Just on your first question, we have engaged Provincial Treasury. The rollovers is a specific engagement with Provincial Treasury. The money that we are talking about is provincial money, and we have a very good standing relationship with Provincial Treasury, and they have given us the 101 million that we require from rollovers as agreed with Provincial Treasury. So it is because of our history and our relationship with them. Our big engagement with Provincial Treasury was that we have the shortfall with the staffing because of the compensation of employees, and that is what we got from the national allocation. So we are very satisfied that because of our relationship with Provincial Treasury, we have the resources we require to cover our financial needs for this financial year. I'm going to ask Mr. Kay just to go into the detail of Member Van Vogel's second question about the health facilities management decrease, and then Member Barnes's question about COE for assistant nurses. There's obviously detail, and that amount of money is a small amount of money, and Mr. Kay can just explain that. And then Mr. Kay can also touch on the building and funding structures, where the reductions of that has been. And then also the issue about the staff, get this correctly from the rollovers, the staff functions, I guess, that you're asking for. And thank you very much for Member Allen for the commendation. Thank you for that. Mr. Kay?
Thank you, Dr. Kluti, and again, good afternoon to the members and the Minister and the Chair. So the first question on rollovers and why PT didn't fund us with additional money. As I explained in our last session, we had some savings from the previous COVID allocation, which we have asked and used in the current year to fund our fourth wave. We asked for 211 million rand from the Provincial Treasury, and we've been given that money. In fairness to the Provincial Treasury, the Omicron variant was announced after we'd had this allocation, and so they have said if we need further funding, the same as what happened last year, there may be scope for a third appropriation should we require additional money to manage the Omicron variant. So that's the first one. On the facilities management, so again, there was a request. There have been a number of, I guess, maintenance projects and the like that have been impacted by COVID. And because of that, we haven't been able to incur expenditure. That is on the maintenance and the capital projects. And the recommendation is it is better for us to surrender that funding in the adjustment budget for it to be earmarked for next year when we will be given that money. So it's a timing difference. That does include the funding that was allocated for the Klipfontein project, where the PSPs have not yet been appointed. And because the PSPs have not been appointed and it's been re-advertised, nothing has been awarded, so we cannot spend that money. Regarding the Presidential Youth Initiative, so we used the Presidential Youth Initiative funding to renew contracts under our COVID and our vaccine response, but primarily our COVID response. So we've used that as a source of funding to extend the contracts for the fourth wave to the end of March. For those people that qualify within this particular program. I think I've spoken to Member Barnes. I hope I've answered your question when I answered Member Winvogel's question. And then regarding the administration, so the additional money that comes into administration is for our centrally held COVID funds. So that includes things like NHLS testing, where we've held that separately, and things like PPE, where we've got a central store. So that money, that allocation of the 100 million rand, there are some rollovers that have also come into that into the administration program, but primarily the COVID response funding is for testing and for PPE. The other funds were transferred out from a vaccine perspective, were transferred out into the programs where those activities happened. And obviously the compensation for employees sits in different programs and different sub-programs where those particular facilities are managed. And that is primarily in program 2, specifically to program 2.9, which is the district hospitals, as well as program 4, which is for the regional hospitals, and program 5 for the central hospitals. Thank you, Chairperson.
Thank you very much, Mr. Simon K. Members, we now move over to pages 106 to 112. Are there any questions from members on that pages? I do not see any hands at this stage. Member Winvogel and Member Barnes, in that order.
Chairperson?
Yes, Member Winvogel, we can hear you now.
Yes, I just want to check on page, is it 106?
That's
correct. Subprogram 2.3 Community Health Centers. I know that 10 million has been made available to address the over expenditure in nursing and medical agency services at Khayelitsha Hospital. Can the department explain how much in total has been available through this budget to address the overspending in nursing and medical agency services, and how many nurses have been employed at Khayelitsha Hospital? And then, Chair, Yeah, I think I will park there. Thanks, Chair.
Thank you very much, Member Van Vogel. Member Barnes.
Thank you, Chair. I'm not sure if Mr. K answered the question, if it's related, but let me ask this question because it sounds related. On page 111, shifting of funds vaccine program, total of 74561. Is this an indication that the Western Cape vaccine program is failing? What is happening, Chair? What is the update regarding the CTICC vaccine sites and how much will be spent? I only have that one question. Mr. K answered, but I'm not 100% sure if it's the same funds we are speaking by. If I can just get a feeling on that, Chair. Thank you.
Thank you very much, Member Barnes. Over to the department.
Thank you, Chairperson. Just maybe on the first question from Member Van Vogel around medical and nursing agency. There is obviously that adjustment was to add to medical and nursing agency over expenditure at Khayelitsha Hospital. We will have to get you the total amount because we don't have it readily available for you. But it is really about the pressures felt in Khayelitsha Hospital. And it's in terms of the pressures that's not only COVID related, but it's the psychiatric pressures, the trauma pressures, etc. in Khayelitsha Hospital. Then in terms of the second question from Member Barnes, I think Mr. K can elaborate on that, but it's two different things. The one is about the buildings, it's a link to Tygerberg. That's where you're talking about. And the CTICC, just to make that thing that we've had a agreement with CTICC that's now come to an end, and we formally closed the vaccination site. But over to Mr. K.
Thank you, Dr. Kuti, and thank you for the questions. So, Member Barnes, what we did in the original budget is we allocated 150 million rand into the administration program because we didn't know at that point in time what shape the vaccine program was going to take. So what we did is instead of allocating it specifically, we put it in one particular space, which gave us the flexibility. What the adjustment budget gives us the opportunity to do is to now shift the budget from program one, which is the administration, to where the expenditure has actually happened. And that is, you're correct, the CTICC is one of the places where the expenditure has happened. There are it's the Athlone stadium where expenditure has happened, but there has also been quite a lot of expenditure that has been incurred in Metro Health Services and rural health services in terms of appointing additional staff, security, cleaning services, and the like to be able to support the vaccination rollout program. So this really just gives us an opportunity to allocate the budget to where the expenditure has been incurred, because in February last year, this year, we didn't know what our vaccination program was going to be like. Thank you very much, Chairperson.
Thank you very much, HOD. Thank you very much, Mr. K. Member Van Vogel, is that an old hand? Or you still have a question?
It's a new hand, Chair.
Relevant to pages 106 and 112?
Yes, Chair.
You may proceed, Member Van Vogel.
Relevant to 106, is it 112? Yes.
You may proceed, Member.
Yeah, Chair, mine is the last question on 109. That's sub-program 8.6. Regarding the 125 million reallocated due to slow progressing projects. So which project were these and what caused the delays? And why are these funds not reprioritized and spent to build waiting areas in community clinics for instances? And then the last one is page 110, Chair. The shifting of funds. I think the I'm not sure if the HOD or was it Mr. I'm not sure. Who I think he mentioned something of shifting funds, but I'm not sure was it emergency funds or for COVID-19. I just want to know a total of 26.8 million of COVID-19 emergency funds is unspent. What are the reasons for this, and what were these funds earmarked for? Thank you so much, Chair.
Thank you very much, Member Windvogel. Over to the department.
Thank you, Chairperson. I'm going to ask Mr. K to respond to both of those questions. Thank you.
Thank you, Mr. K.
Thank you very much, Chairperson. So let me just start, Member Windvogel. If you look at the details on page 110, you will see the reasons and the rationale why we had savings in certain places. So primarily, if one looks at, and sorry, I'm just scrolling. If you have a look at, for example, sub-program 2.9, which talks to goods and services 16 million rand, we had an efficiency saving in Brackengate, which we were then able to transfer to the Lentegeur Field Hospital, where they had additional pressure. So again, this is a case of us allocating budget on a best estimate on where COVID was going to happen and the pressures that were going to happen. And what has shown us is some places we've had efficiency gains and other places there have been pressures for various reasons. And we are allowed to, at this point in time, shift those funds around to correctly fund the activities where they happen. So it's this is the opportunity that we then get to be able to do this. Then I just want to check, my apologies, because I'm just trying to see. So if the, and I'm moving a chairperson to Annexure B to vote 6. Annexure B to vote 6 gives the detail of what facilities we are have we got on our planning list, which facilities are active, and which facilities we have shifted budget from and to, and the facilities that we have surrendered funds on. So the detail that Member Barnes is looking for will be found in the Annexure Annexure B, which starts on page 135, and it gives a fair bit of detail. Thank you, Chairperson.
Thank you very much, Mr. K. That concludes that round of questions. Members, we are now with pages 113 to 118. Any questions from members on that set of pages? I do not see any hands. Members, we then move to pages 119 to 124. Any questions from members on that pages? I do not see any hands. Members, you are now also welcome to pose your questions to the annexures, which is pages 125 to 145. Are there any questions from members on the annexures? I do not see any hands. Members, thank you very much. Ms. Jamke, can you kindly assist me at this point? Do we have any members of the public present that wishes to pose a question?
No, Chair, no members of the public.
None.
None.
Ms. Jamke, in terms of our schedule, our program, that concludes the questions on vote 6 this afternoon.
Yes, Chair.
Thank you very much, members. At this point, I wish then to thank Minister Mbombo. I wish to thank the HOD, Dr. Keith Kluter. Allow me also to thank all department officials for the wonderful and the sterling work that you are doing. Thank you for keeping our finances safe and doing the best with what you have, and even stretching it further at many points. So at this point, we will excuse you and thank you so much for your indulgence this afternoon. Keep well and be safe.
Thank you, Chairperson. Thank you to the members.
Thank you, all the honorables, and thank you to the department. Thank you.
Thank you.
Thank you.
Thank you.
Members, thank you very much. Ms. Jamke, we will now deal with the report, with the committee report.
Chair,
Yes, Member Van Vogel.
sorry that I'm not raising my hand because I'm struggling to, I don't know, it's something wrong with my buttons or I'm doing something wrong. But I just want to check, are we not going to look at the resolutions? I just want clarity on that.
Yes, we will record resolutions as well, Member Van Vogel.
Thank you, Chair.
Sure. So members, you can all see the report, the committee report on the Standing Committee on Health on vote 6 in the schedule to the Western Cape Adjustment Appropriation Bill B6 of 2021, dated today, as follows: that the Standing Committee on Health, having deliberated on the subject of vote 6, Health in the schedule to the Western Cape Adjustment Appropriation Bill B6 2021, refer to it in accordance with Standing Rule 118, reports that it supports the vote. I recognize Honourable Botha.
Thank you very much, Chair. I propose that this committee supports the vote.
Thank you very much, Member Botha. So recorded. I recognize Member Allen.
Thank you, Chairperson. I duly support Member Botha's motion to support.
Thank you very much, Member Allen, for that concurrence. I recognize Member Van Vogel. You are muted, Member Van
Sorry.
Vogel.
Sorry, Chair. The ANC will make use of the minority view on Section 90. Thank you, Chair.
Thank you very much, Member Van Vogel. Can we just beam up the committee report again, so that we are all just in concurrence as it reads correctly? Members, we are in concurrence that the committee report reads as follows: the report on of the Standing Committee on Health on vote 6 in the schedule to the Western Cape Adjustment Appropriation Bill B6 of 2021, dated today, as follows: that the Standing Committee on Health, having deliberated on the subject vote of vote 6 of Health in the schedule to the Western Cape Adjustment Appropriation Bill B6 2021, referred to it in accordance with Standing Rule 188, reports that it supports the vote, and the minority view in terms of Standing Rule 90. The African National Congress expressed its minority view to not support the vote. In order for the report to be considered, members, can I ask that we adopt the report accordingly? I recognize Member Allen.
Duly adopt. I would move that we adopt. Thank you.
Thank you very much, Member Allen. Member Van Vogel, I see your hand.
Hold hand, Chair.
Thank you very much. Member
Barnes seconds, Chair.
Member Barnes.
Seconding, Chair, adoption of report.
Thank you very much, members. Ms. Jamke, is there any other business that the committee should attend to?
I think, Chair, at this point is the resolutions, if there are any.
Thank you very much. Members, Member Van Vogel.
No, Chair, I'm not sure how did I miss that part. I need clarity on this 74 million for Western Cape vaccine program. And it said that it has not been spent and it's been shifted to another program. Part of this shifted towards the Athlon and CTICC vaccine side. But the CTICC was closed down on the 2nd of December. So this does not make sense. If I can get clarity from the department on that issue. And then secondly, Chair, they didn't spend the 10 million, but no, I think he covered that part. No, thank you, Chair. That's the only thing.
It's only the one resolution. Any other members?
Yes.
None, it seems. Members, then this concludes our business of the day. Thank you so much for your participation and thank you so much for your indulgence. And I believe this is the last committee meeting for 2021. Allow me also to express my sincere thanks and appreciation to each and every member for your valuable contribution to this committee. Thank you so much, Ms. Jamke, for your unwavering support to all. I also recognize Ms. Marianne Burgess. Thank you to you, Mr. Shiraz. Thank you so much for all of your support during this year. I wish that you will have a safe and a wonderful and a very blessed festive season with your loved ones. And God willing, we will all see each other in the new year in committee. Thank you so much and have a wonderful day. This meeting is now adjourned. Thank you.
Thank you.
Thank you, Chair.
Thank you, Chair. Bye-bye, members.